Okay, so welcome, Dr. Roberts. Dr. Roberts is a speech language pathologist and holds a joint appointment in the School of Communication Sciences and Disorders and the Department of Computer Science at the University of Western Ontario. She's also the Canada Research Chair in Data Analytics and Digital Health in Cognitive Aging and Dementia. Her impactful research improves outcomes by developing tools that help track dementia progression at home and by building interventions that address communication challenges and experiences by persons with dementia and their family members. So welcome, Dr. Roberts. If I missed anything, please correct anything that I've said. We really look forward to learning from you this evening.
You miss nothing. And thanks everyone for listening in on the early part of our conversation. I'm happy to say that we'll gladly answer any questions on that as well. So you caught us talking a little bit about BCI and really in this kind of larger space of the challenge of kind of getting accurate diagnosis for dementia as well. So the only thing I'll say before I start sharing my slides, and it's not in my formal intro, is that I join you tonight both as a professional, but also as a previous caregiver of someone who had dementia. So until December of last year, I was the care partner for a family member of mine who actually lived with me through their dementia journey. And so I come to you tonight with that honest face of being both a teacher, but also a student of your experiences, but also as a teacher who shares my own. So I'm going to share this now. So I'm hoping you can see that, Catherine, and we'll go to,
Yep.
Everything good? Okay.
That's great. Thanks.
Perfect. So thanks everyone for being here with us tonight. I'm going to keep an eye on my time and do my best to move through this in an efficient way. And then hopefully leave lots of opportunities for questions afterwards. But I'll ask Catherine just to give me a nod in the case that I go over. And if I go too fast, please don't hesitate to stop and ask questions. So I'll start a little bit by just defining what we think about, and we kind of use this term dementia, but what we actually mean is dementias. And what I have on the screen is a little bit of a family tree of the different types of dementias that at least we commonly see in clinical practice. And these include, dementias that result from Alzheimer's disease, dementias that we associate with the frontotemporal dementias, Lewy body disease, and then of course, something you heard us chatting about, which is a cerebrovascular disease. And that's a form of dementia that comes from either brain changes that are associated with kind of having unhealthy blood flow to the brain or the connection between the cardiac system and the brain, or can also be caused by strokes, even very small strokes. That you may not, or someone may not be aware that they've had, but are enough that are accumulating and kind of lead to dementia. So we think about these four big categories. And then within Alzheimer's disease, we think about Alzheimer's dementia, something called posterior cortical atrophy. This newer syndrome that we think about as being late, which is a form of Alzheimer's disease that occurs very much into older age, like after the age of 80. And then we have this kind of entity that we call logopenic primary progressive aphasia. Now, this gets a little bit confusing because those of you may be thinking, gosh, my loved one has primary progressive aphasia, and I've been told it's this logopenic variant, but I didn't know that that was caused by Alzheimer's disease. And indeed, some of the primary progressive aphasias, although we put them underneath this frontotemporal dementia heading, can actually be caused by Alzheimer's disease pathology. And so it's kind of interesting when we think about the dementias, we think about the clinical symptoms and we think about the disease, the underlying disease that's causing that form of dementia, that form of clinical symptom, that kind of profile of clinical symptoms. And in this realm of PPA, it does get a little bit confusing. And for those of you who may not be as familiar with PPA, PPA is a form of dementia, or primary progressive aphasia is a form of dementia that primarily affects the language system. So your ability to speak, to understand, to read, and to write. And it's in contrast with what we think about with kind of the classic dementia, which is Alzheimer's dementia, which is more characterized by memory changes. So the kind of takeaway message from this is that it's not really a dementia, but dementias, and that there are many different types of diseases that can lead to these clinical symptom profiles that we give labels to, like primary progressive aphasia or vascular cognitive impairment or Lewy body disease. But at the end of the day, all of the dementias that I just talked about have this kind of common impact on language, speech, and gesture. And by language, we mean the different symbols and rules that we use to express our thoughts and emotions. We kind of think about those as letters and words and how we put words together into sentences. And speech is really the kind of motor movements of how we move our tongue and our lips and our vocal cords to be able to generate all those ideas that we've put into symbols and words. And then gesture, of course, are the movements of other body regions, our facial expressions, our leg movements, our hand movements. I talk with my hands a lot. And all of those kind of domains come together to help us express ourselves and to convey our emotions, but also to understand others. And we put this under this larger heading of what we call communication. But regardless of the dementia type, although different dementias start with different profiles, and some may be more memory based, and some may be more language based, and some, like the Lewy body dementias, may actually affect the motor system a bit more. At the end of the day, there's not a single form of dementia that does not touch all three of these domains. And there's not a single form of dementia that, whether at its outset or later on as it progresses, that doesn't have a significant impact on communication. And so when we think about the communication declines that we kind of see in dementias as more of a classic approach to thinking about how the kind of progression of these symptoms occur over time, we generally see that language and speech changes progressively, but it often does so in such a way that there are these plateaus where people seem to be doing well for a little bit and then they'll just kind of drop off. And these seem like sudden changes. And this can be sometimes confusing for family members who may think that the individual that they're helping to provide care for has had a stroke or had something else go wrong. And while that can be the case, it's not altogether unusual for us to see these kind of sudden drop-offs in language or in speech function over time. Oftentimes, when we think about changes in language and changes in speech, this can be complicated by changes in memory, difficulty problem solving or doing two things at once, difficulty with behaviors that seem to not be exactly conforming to our social norms, and even changes in hearing as we get older. And we actually know that there are some forms of dementia that are more associated with hearing loss. And in fact, we know that people, for example, who have Parkinson's disease are more likely to have hearing loss compared to the typical population. We know that hearing loss and changes in cognition actually go side by each and go together, to the point that we actually think that, and there's some studies looking at whether or not managing hearing loss can reduce the risk of developing dementia. So all these things that we kind of see in the context of the brain changes that lead to communication changes in dementia can actually be complicated by just a lot of other components of aging, that can actually be exaggerated in some of these conditions. So when we think about the impact that these can have on everyday conversations, and I'm assuming that many of you, as I go over these, will say, yep, I've seen that. And yes, I recognize that. And really, this list is not to be exhaustive, but it is to help you to recognize that, yeah, if you're seeing these symptoms in the person that you're helping to provide care for, it's not at all unusual. And you'll see that I have not divided this list by what to expect if someone has Alzheimer's, dementia, or what to expect if someone has vascular cognitive impairment, or what to expect if somebody has primary progressive aphasia. And I haven't done that for a very intentional reason, which is, going back to what I said a bit ago, which is regardless of the dementia type, regardless of the underlying disease that's leading to dementia, what you're going to see is one or multiple of these symptoms as they impact everyday communication. And those can include slowed or speech that feels halting at times. We do see this more in Lewy body dementia, and we do see this more in some forms of primary progressive aphasia. And you can also see it in some aspects of vascular cognitive impairment. So the idea being that the symptom is not specific to a dementia type, but that there are many different forms of dementia that can show some of these symptoms. changes in the ability to initiate conversation or talking less or covering fewer topics or less diverse topics is relatively common. Regardless of the dementia type, we can see difficulty finding words. And we know that those word retrieval challenges can look like a variety of different behaviors, from using an incorrect word to substituting one word for another, to pausing or hesitating when talking, mispronouncing words or switching around sounds, or even talking around a word so that they're describing what they want but not able to come up with a specific word. That's a behavior we call circumlocution. But again, across, we think about, well, word retrieval is classic for primary progressive aphasias. We see it sometimes in Alzheimer's dementia. And people will lead you to believe that those are the dementias where you tend to see this behavior most. But as someone who works in this area, I can tell you there's not a single form of dementia that leaves the ability to find words untouched. Most of the dementias, you'll find people struggling to find the right word. So forgetting names of familiar objects can certainly occur. And importantly, you can see new changes in spelling or in the ability to do math or finances that aren't just memory-based problems, but actually difficulty doing the calculations or difficulty forming letters or difficulty spelling. So we've kind of established that there's lots of different forms of dementia, and many of you living with people with dementia may have experienced one or many of those. And we've established that changes in communication are ubiquitous. There's not a single dementia that's left untouched by this phenomenon. And we've even talked about how there's lots of different symptoms that overlap across these dementia types. The reason why that behavior may be impaired may differ, but the symptom itself overlaps across different dementia types. And now I want to take just a moment to kind of talk about conversation. I'm going to transition us here to thinking less about the actual behaviors that we see and more to thinking about how this has an impact on everyday interactions, and then move us into thinking strategically around what we can do to help support better communication at home. So conversation for me is something that on the outset, you're like, gosh, why is this person defining conversation for me? Well, I'll tell you why, because it's something that we learn how to do without even thinking about it. I mean, we certainly understand if someone's a good conversationalist or they're a bad conversationalist, and we understand when we've had a conversation go right and when it's not gone right. But having a conversation with something, none of us really remember sitting in class and having a teacher say, here's the 3 steps, here's how you have a conversation, let me teach you how to have a conversation. It is something that we just learn implicitly. And in fact, having a conversation, our ability to have a conversation with other humans actually begins at the moment of birth. And there's some people who argue that it begins prior to that, but that first moment, that first eye contact that an infant has in the world around them is what we think about as being the first step, or the first step in conversation behavior. That ability to create joint attention with another human being and to hold their attention is a primary skill that helps us go on as our words develop and our sounds develop to actually have a conversation. So it's not something we learn as adults. It's actually something that as humans we're hardwired to do. And so conversation is a behavior that is about, of course, we use it to get information back and forth, but its purpose, its social biological purpose to humans is to help us establish and maintain relationships so that we can connect meaningfully with others. And it's the primary mechanism that we actually use as humans to acknowledge the interconnectedness of all human beings. Now, that could sound a little bit airy-fairy, and that's not intended to do that. It actually is, from a biological perspective, how we establish and ensure that we're connected to the network of other humans around us. And so it is a key skill, and it is something that we often see eroding even in the early stages of dementia. And one of the challenges is that those conversation losses not only are problematic with getting information across, but they can also create challenges in feeling isolated from the other person, this sense of loss of connection to them, but also their connection to the world. So when we think about working in this space, when we think about the importance of building better habits and better rules around communicating, when we think about starting to use strategies to help support communication in the context of living with dementia, we do so not just with the aim of helping information A get to person B, but in really thinking about this as an avenue for reducing stigma and isolation, not just for the person who has dementia, but also for the care partner. We think about improving quality of life, and that includes your quality of life as well as the person with dementia. And while I didn't bring these data with me tonight, and I'm happy to talk about them more in our, in our conversation that we'll have after this, we've actually been doing some studies that look at the direct relationship between changes in conversation and changes in quality of life for both the person with dementia and their care partner. And actually showing that when we treat and address those challenges, we can improve quality of life for both people. So this isn't just kind of, some idea. We actually have some evidence to support that this is the case. Preserving this idea of what we think about as autonomy. And so you might say, gosh, what does that mean? It means preserving this idea that a person has their sense of self. And that includes the person with dementia, but it also does include the care partner as well. So when we have good communication in place, when we're able to support successful conversation turns, we're actually helping to preserve the identity of the person with dementia, their agency, their ability to assert who they are to the people around them. And of course, activities of daily living are just easier when communication is easier and our ability to kind of engage in meaningful activities that help to maintain that connection. So I'm going to transition here just a little bit. So we've, now identified kind of how we think about conversation and getting ourselves settled into that space to understanding this isn't just about words. It's not just about sentences. It's not just about reading or writing. It's actually about this larger concept of how we use communication to connect to others, to connect to the world. And so I'm going to introduce a bit of a different concept here. I'm going to keep layering on this information to thinking specifically about something we call interactional versus transactional communication. And some of this comes out of social communication theory, and some of it comes out of early social work theories. And some of it just comes from this space of human biology and the different types of communication that we actually need to be healthy humans. So transactional communication, you can think about this as the language exchanges that you and your partner have every day that are focused on getting information across and completing tasks, right? So this actually makes up in kind of everyday human exchanges. This makes up around half, if not a little bit more, of all the communication exchanges that we have on a daily basis. Getting the job done through talking to one another or through communicating to one another. But there's this shift that we see, and here I've labeled this as the person with PPA. This comes from some research that we've done specifically in primary progressive aphasia, but we've also seen the same behaviors in Parkinson's disease dementia, and we've seen the same, this data we've replicated in Alzheimer's dementia as well, which is that over time, living in the context with dementia, we see this shift. If normally we expect about half of our interactions to be transactional in nature, so again, talking to get the job done, in the context of living with dementias, we actually see that balance becomes severely imbalanced, and the amount of transactional communication that we see becomes as high as 80 or 90%. And so that means that and we do these studies. Those of you, we don't want to frighten you, but we literally become flies on the wall and we look at the types of interactions that are happening in people's homes. And what we've shown now in at least 3 different groups, is that this idea of this shift, and especially as dementia becomes more progressed, we see that shift happen in an even greater way, where instead of it being about half of the communication attempts are transactional, again, 80 to 90% become transactional. That's really problematic. And I'm going to pause there and I think invite you to just take a moment as I kind of talk through this to reflect on your own everyday communication interactions. And the reason why it's problematic is, as I mentioned before, we need this balance of interactional and transactional communication connections. And when conversations become predominantly transactional, then we start to shift into that space of lower quality of life, difficulty asserting one's agency or preserving one's personhood. We actually see all of those behaviors go together. And the primary driving factor is this shift in communication style. Now, I mentioned to you earlier that I had been a care partner of someone who had dementia. In fact, they had primary progressive aphasia, the agrammatic variant, and a genetic form that runs through my family. And we know that gene, we know who's at risk of developing this form of dementia. So it's a particular passion area for me. And and even though I know this science, even though it's the science I've done, I can honestly say that as my person lived in my home with me, my conversations had become more transactional before I even realized that that had been the case. And just like all of you, I had to step back and reflect and think, gosh, am I really preserving this balance of transactional with interactional communication? So it's not easy to do. And it's very easy to kind of let the majority of conversations go this direction. So when we contrast that with what we call interactional communication are those moments that we have that are more than just message exchange. Their value is in connecting, even if, the message is not wholly correct. And it allows us to consider perspectives, emotions, and expertises of both partners. So I'm going to pause there. I see that there's a Q&A, so I'm just going to check that. Can I give an
Yeah.
example of transactional communication? Yep, I sure can. So I can, and I can give you one of the 5,000 examples from my life, or I'll just give you a generic example. But a transactional communication is one that might say, can you take the garbage out? Right? Or we're going to have, we're going to have sausage and butternut squash and apples for dinner. Or what do you want from the grocery store? So that would be kind of how we layer on that transactional communication, the definition being, information is really about either accomplishing a task or with the pure purpose of exchanging information or asking for information. So, let's get your shoes on. We're going to the doctor's office. We're going to stop by the grocery store on the way home, and we're going to get eggs. And then we're going to come home and watch the news, right? So that would be something that's much more in that line of getting information back and forth, requesting information, or actually organizing a task that needs doing between both people. And so thank you for that question. Interactional communication is a little bit different. So this is the type of communication where you might just be sitting on the bench together in silence, holding hands. You might just be sitting there talking about the birds and what they're doing at the bird feeder, but not necessarily needing anything to be achieved by that conversation. And so in our lives, we need both. We need this transactional space and we need this interactional space. And in fact, particularly in living with dementia, we need to retain that balance because over time, transactional communication gets harder and harder and harder as language erodes and conversation becomes more difficult. But this space, the interactional communication space, is typically preserved into the absolute last days and later stages of dementia. And I'll give you an example from some of the research that we've done in this space. We have a few studies that we've done where we've looked literally at the connection between brain signals between the person with dementia and their care partner. And we've looked at that using technology, we call it EEG, which measures brain waves in each person's, the brain activity in each person's brain. And we've actually looked at the synchrony how how that brain activity moves together during transactional communication and during interactional communication. When transactional communication goes wrong, we see a dyssynchrony, or those brain waves become out of sync. In interactional communication, we actually never see that. It's largely almost always successful, and it keeps two people's brains in synchrony with each other, which we actually expect in the context of conversation. We've actually looked at this in people who were nonverbal, who were not able to communicate at all, people who we might call in the last or later stages of dementia with their care partners, and we still see their brains operating in synchrony. And so what does that tell us? That tells us that people with dementia, no matter where they find themselves in their ability to communicate, or their language changes, or their speech changes, are recognizing and aware of this interconnectedness that happens through interactional communication. And so there's a value in connecting, there's a value in communicating, there's a value in using touch, there's a value in holding hands, there's a value in making eye contact, there's a value in sitting and just being and focusing on a central thing in front of you, even if that person does not appear to be interacting with you in a way that you can recognize. And we know that value is there because we literally can watch two brains working together in that context. And so I'll pause there before I go on to see if there's any questions, because I think this is the space that we don't talk about enough. So I'm a speech language pathologist. I've spent 20 years developing some of these interventions and almost 30 years in clinical practice. And I still have to teach my colleagues the difference in transactional and interactional communication. And I still have to teach them the importance of teaching you how to have those important moments of interaction, and how it's vital that we actually have moments of communication where we have no expectations at all. That if the words aren't right, if the ideas aren't conveyed, that's okay, as long as you just have that opportunity to sit and be and to connect and to share in that relational space. And again, our brains and how our brains operate tell us that that's important. Okay, so I'll keep moving along just for the sake of time, and then we can maybe have a few more questions at the end. So I'm going to spend a little bit of time in this last space talking about scaffolding for success, and talking about some of the communication strategies that we teach. So we have a clinical trial that's active now. It's our phase 2.5 clinical trial of speech language interventions in primary progressive aphasia. We've also done this in Alzheimer's disease. And I have a program that we run in Parkinson's disease dementia as well, where we actually teach families communication strategies, and we work with the person who has the condition and their families when we do this. And a lot of what we teach in these interventions are about scaffolding for success. So I don't have to tell any of you that as dementia progresses, care partners have to pick up more and more and more of the load, and that both involves changing of roles, changing of what you would do, and just how your daily life functions. But it also means that we have to often take on this role of helping the person with dementia to be successful, and nowhere more is that true than in the context of communication. But I like to think of this not as, it's not our job to replace the fact that they have difficulty communicating, but it's our job to really set them up to be successful, to serve as a scaffolding or to serve as a ramp that actually helps them to and aids their ability to communicate. Some days this means we're doing a lot of the work, and other days this means that the person with dementia is able to do more. But a lot of the strategies I'll share with you over the next few slides are some of the ones that we teach that are in this area of how do I make sure that my partner's competence can be revealed? How do I reveal what they can still do? How can I focus positively on what they're still able to do in the communication and conversation domain? And how do I set up to really acknowledge their expertise, this knowledge that they still have their identity, they still have their personhood, and how do I make sure that comes through in everyday communication? So I'll start with a little bit of this reminder that communication is multimodal, and we do it through speaking, writing, we can use pictures, we can use gestures, we can use technology, including texting, we can just point to things. But communication isn't just talking, and we sometimes forget that. We think, I understand that a conversation is about me talking and someone else listening, but there's so much more in this communication domain that we can use. And this is really important when we're thinking about people who have dementia, because remember I said at the beginning, it doesn't really matter the form of dementia. All of these areas are going to be affected. So people are going to have difficulties with speaking and writing and perhaps gesturing and understanding. So what does that mean? It means that we have to not just depend on one domain like talking or listening, but that we have to really optimize multiple domains to help communication to be successful. And I'll show you what I mean by that in a minute. But one of these first rules to kind of dementia care or dementia communication is to remember that it's multimodal and we need to use more than one channel to get information in and to help them to get information out. And so here's an example of kind of multimodal support. So this is an example. These are real life cards that I helped to make for a client. And these can be done in different ways. This was an example of someone who had Alzheimer's dementia. And so what we did, these are actually pictures that are taken of the meals that were prepared in their home. So that part's a little bit important here because we didn't just use stock photographs that came out of a magazine. We actually took pictures of the salmon sandwich that they normally eat, the macaroni and cheese that might be on a plate from their house. And for some people with dementia, having those photographs that are taken in context can actually be really helpful. They may not always recognize abstract photographs, for example, of a sandwich. But if it's a sandwich that's taken that looks like the sandwich they eat for lunch every day, that's on the plate, on the table, in the context where they partake of that sandwich, it can be really helpful for unlocking language. So I like to tell family members, get everybody active in your home, taking pictures of favorite objects or favorite meals or things that people might have difficulty retrieving the words for, and actually use those to help create these cards. The second thing you'll notice is that each one of these cards is labeled. So some forms of dementia don't require the written label, others do. In this case, we were developing this, as I said, with someone who had Alzheimer's dementia in their family. And so we wrote the labels on each card, and we did so in a very simple font, typing it in black font on a white card. And so the way this worked is that this person would, when they were having trouble finding a word, would actually use these cards to clarify what they wanted. And additionally, they would stack these cards working with their partner to create kind of their lunch menu for the week and their dinner menu for the week. So this became a communication activity that the person with dementia could do with their care partner to do their meal planning for the week, sharing that activity and collaborating on what they wanted to eat. And then the person with dementia was able to use these cards to contribute to that process. One of the other strategies that we like to teach is that actions speak louder than words. And this is incredibly important to remember with people who have dementia. One, it's important that you communicate with your whole body and that communication is consistent. So if your body says you're angry, but your face says you're happy, that's very confusing to a person with dementia who may be depending on some of those nonverbal cues to understand what it is that you're trying to say. So remember that multimodal rule. So people with dementia have an awareness, and their brain has an awareness that there's certain signals, there's certain inputs, like maybe speaking or understanding, that they're not getting as much of. And so the brain starts to activate to try to draw in more information. And so some people with dementia actually become more dependent on these body cues. So they're not just listening, and they're not just watching what you say, they're actually watching what your body is doing in that process. And so when those messages are mixed, it can be really hard and actually cause confusion for people with dementia and make it more complicated for them to understand. It's important that, and we try to remind people to say and show what you mean. So that means that you can walk through something, you can point to something, you can talk about it, you can do that with your body. But it's important to kind of, again, layer on that information so you're not just talking about it, but you're also showing it when that's possible. And we try to always remind people, and again, you guys are probably fantastic at this, but these are maybe some rules to remind friends and family of when they come over, to be careful with humor and figurative language and using metaphoric language. it's raining cats and dogs. It's, hotter than Texas in here, like whatever it is that are common expressions that we kind of think about is we know that saying it's hotter than Texas means it's really, really hot outside. But to someone with dementia, they may literally be interpreting that as it's hotter than Texas, and they're looking at Texas to find out how hot it is in Texas, and this can be a very confusing process for them. And so that loss of metaphors, that loss of figurative language, sometimes difficulty interpreting humor can be an actual quite early change that we see in some dementias and can lead to misunderstandings. So if you're uncertain about someone's emotional intent, ask, are you angry? If they look like they're confused, be more explicit about what you mean. I'm not angry with you. I'm just frustrated, or I'm not angry with you. I just closed my finger in the door and it hurts. But you might have to actually be very explicit about what you mean and what your emotions mean. And when we think about conditions like primary progressive aphasia, which I have in that last bullet point, again, Parkinson's disease is another place that we see this. These conditions can actually affect how emotions are processed and understood. And so it's important, again, to clarify kind of what you mean by certain messages. Again, talk through that, show through that, and make sure that your body language is consistent. I like to remind people, and again, I'm going over these quite quickly. Keep in mind that when we actually teach these in a clinical program, it can take us 10 to 12 weeks to teach families how to do these strategies really well. So if you're taking notes and thinking, gosh, I'm going to go home tomorrow and do all of this at one time, don't think you have to do that. In fact, you may find it's difficult to put more than one of these strategies in place at a time, and you should be patient with yourself as you try to put these strategies in place. As I said, for us, it can take weeks to work with family members on how to do this, and to feel confident in using these strategies. But active listening is something that is another area that we teach a lot about. Which is working with families and conversation partners to be present in the moment, to be mindful of your own intention and your emotional state. And this gets back a little bit more to that interactional and transactional communication concept. What is your intention in this moment? Right? And being incredibly aware of that. If your intention is to test the person with dementia so that you can see whether or not their dementia is progressing, that's never a good intention for communication. If you're really frustrated and upset about something that happened earlier today and that's coming into the conversation, you can bet that the person with dementia is going to pick up on that and be aware of that. So being mindful of kind of what you bring into that space, choosing times of the day carefully to have conversations, both when the person with dementia is not fatigued, but also when you're not fatigued or tired. Being patient, both with yourself and with the person who has dementia, and sending signals that you're paying attention, such as maintaining eye contact or reaching out to touch them on occasion, just letting them know that you're present while they're talking and that you're really present in that conversation. And it's okay. It's perfectly okay in a conversation to not just pretend that you understood, but to actually say, did I understand you correctly? If I understood you correctly, you want macaroni and cheese for lunch. Did I get that right? Sometimes I know I get it wrong. And give them the opportunity to say, no, it was a roast beef sandwich. Now, they may very well have said macaroni and cheese, and maybe they got the wrong word out. But the intention here is not that they got the word wrong. The intention is that you've correctly understood what they do want so that you can deliver on what they would want to eat in that moment or what they want to do in that moment. And so I use these expressions a lot. We teach family members how to use these expressions. And sometimes it feels like in a whole day when I'm working with someone who has dementia, I'll say these 100 times. Did I understand you correctly? I understand that you want this. If I understood you, I think you want to go to the bank today, but I want to make sure I've got that right. It's much better to verify that understanding and that you've heard correctly and listened correctly, than it is for that misunderstanding to become more problematic. I'm going to shift gears here just a little bit now that you've got some kind of foundational rules of thinking about, gosh, might be some things I can do to support communication, and walk you through a little bit of how we adapt these for people living with different dementias. And again, this is an example from a person who has PPA, but we apply these techniques very similarly for people who have dementia with Lewy bodies, vascular cognitive impairment, Alzheimer's, dementia. But this idea of thinking about how you're going to transition activities over time, the goal being is that we should make attempts to always engage people with dementia in these meaningful activities. Um, that's part of maintaining both the interactional and transactional balance. It's part of making sure people still feel valued in the roles that they take on in their everyday lives, even though they're going to need more and more support with that. But it's also important for us as care partners to preserve some of our relationship to the person who has dementia through normal activities. So this is an activity that we transitioned over time for a person with PPA. It's an identical activity to what I did with my uncle who lived with me, who had PPA, who had been a finance manager for years. And so our family finances, he took care of everyone's family finances. And so this was a really important area for him. So this is both a clinical activity I did and then adapted for my own real life. And I make that point because it is feasible for us to kind of implement these types of transitions over time. The reason why it was so important, and I can say this having taught family members this for years, but then also experiencing it firsthand, is that keeping people involved in these activities as much as possible for as long as possible was as good for me as it was for my family member. Because it meant that at no point in time did I feel like I was excusing him from his life. And that was a really important component of my own mental health as I cared for someone who had one of these conditions. So I don't pretend to know where you are in your particular caregiving journey, but I do know the power of trying to keep people engaged in these activities, both for the person with dementia and for the care partners. There's an example of how we did it, which is, at the beginning in the early stages, we entered into this collaborative relationship around sharing passwords, showing where accounts were held, allowing the person with dementia to actually create a list of those accounts, and almost create kind of a household book of where all the accounts lived. Again, account numbers, holders, contacts. And then in the middle stages where language was really starting to decline, we still advocated for having the person with PPA, in this case, involved in the monthly banking activities done around the house. But they did so by organizing the bills, marking ones that had been paid. And again, the care partner was taking on a larger and larger role in this, but not at the exclusion of the person with PPA. So she might go in and enter the bill information into their computer banking system, but then hand the bill over to the person with PPA to stamp or mark that as being paid and to file it away. And then even in advanced stages, there's a way to do this. And in this particular case, this family did a wonderful job of keeping the person with PPA close during these activities, talking to them about the finances, maintaining the routine around the household finances in terms of a monthly bill paying schedule. Even when they weren't able to engage in the process, they were still, as a Folsom member, they were still present when the process happened. And so this idea of kind of preserving important routines and using adapted communication and scaling up activities to do that. And then as we kind of move toward this progression chain, I do want to highlight that as, dementia worsens for some people, that kind of aspect of social isolation comes from the fact that friends and family members no longer really know what to talk about when they come over to visit. I don't know whether you've experienced this. I certainly have seen it with a lot of the people that we work with and experienced it myself, where people stop coming over because they really don't want to sit in a room full of silence and they don't really know how to start a conversation. So these are what we call communication boxes. We started creating them, gosh, it's been almost a decade ago now. And this was really an idea given to us by families who were living with people who had dementia. And you'll see several of those pictures on the screen. But what we started doing was not just creating picture albums and picture boxes that people have, but we literally asked people to pull together manipulable objects, pictures, cards, travel tickets from someplace they had been, and start creating these themed boxes. So you'll see the ones in the lower right-hand corner. This was a family who over Christmas decided that everyone in the family would make their own particular conversation box. It was filled with items around a theme that would spark a conversation with their loved one who had dementia. And the one you're looking at the top there was a rather creative granddaughter who actually put a watering can and toy garden shears on the outside, because this was a garden box and she had always gardened with her grandmother, who had dementia at that point in time. The box in the upper left was one created by a son, who was an 18-year-old son of a woman who developed early onset Alzheimer's dementia. And he created that box about them always going to the Cubs games. And so in there are lots of Cubs memorabilia. But we create these themed boxes and encourage family members to put them around the house. And we actually changed them out. So our family members taught us this. One of our families had 50 different of these conversation boxes that people had made, and they changed them out so that when people came over, there was always something to talk about. And they could open up these boxes and there were objects and pictures and sometimes music recordings. And we had one family who actually shellacked Christmas cookies to preserve them, because these were the Christmas cookies that the family had always made together, so they could pull them out no matter the time of year and reminisce about the recipes and reminisce about the cookies. So again, it's not, this is to a more extreme degree of severity where you might need to create these types of boxes, but it's an idea of adapting the activities from the previous slide to always make sure that people have an opportunity to talk about something and to connect, importantly, to connect on a topic or a theme. So I'll leave us with this slide and then open up for questions. I want to reinforce here that I've given you lots of strategies, happy to talk about them, always happy to break down and sit down with people and show you how to use them. But as I said earlier, it takes time. These things don't happen overnight. Learning how to use the strategies don't happen overnight. And even when we are experts at them, miscommunications are always going to occur. There's going to be a moment where you don't feel connected. There's going to be a moment where the message doesn't get across. And I want to encourage you to be patient, always to be calm and patient with yourself and with the person who has dementia, even when it's really hard to do. And I understand firsthand how that can be really challenging at the end of a long day. Try to minimize raising your voice. Remember, we've talked a lot today about multimodal communication. Not only is something we need to do, but it's how the brain naturally starts to process in the context of dementia. It needs more and more information, and it's going to reach out for that information, and it's going to sometimes misinterpret information. So you may be raising your voice in a minor act of frustration, but the person with dementia may recognize that as anger, particularly anger directed at them, and that can lead to sometimes behaviors that are less desirable or also more difficulties communicating. This idea of multimodal supports, and again, I've talked about those a lot today, and I can't emphasize enough how important it is to layer on the types and different ways that you communicate, and also to do everything we can to both show and say or talk and show. This idea of making the world visual around us can be really helpful for people with all forms of dementia. And it's actually okay. Sometimes no matter how much you put something in place, it's just not going to work. And it's okay, provided the person with dementia is safe, to just walk away and try again later. But in doing so, it's important to also acknowledge that the communication moment was difficult for both of you. I'm not understanding you well today. I'm really distracted right now. I'm not able to focus, and I don't think I'm being a great communication partner. I'm going to go out to the garden for a minute and I'm going to come back in and try that again. That part of acknowledging that it's difficult for both of you means that even in a moment where communication is challenging, you've chosen to prioritize the relationship and using communication to connect over depending on communication to always be accurate. And again, that feeds into the space that we were talking about earlier around balancing this interactional and transactional space. So it is perfectly okay to walk away, but in doing so, you do want to make sure that you've acknowledged that difficulty, and not in a blaming way, but in just a recognition way that it's hard for them and it's also hard for you. So I left 2 reflection activities at the end of this slide, and I'll just raise them now, but happy for Catherine to share these with you. The first is really just to go home and kind of think about on a day-to-day basis this balance between interactional and transactional, and trying to shift at least that balance a little bit, really focusing on how many of the interactions you have each day are interacting with the intention and the purpose of just connecting versus needing to get something done. And striving where you can to try to put a little bit more balance in that communication space. I can promise you it's as good for you as it is for the person with dementia. And then this idea of thinking about, are there many different ways that you can communicate? Are there many different ways you can layer in strategies? And how do you pull in this kind of multimodal strategy approach? How do you talk about it, show it, gesture it, use pictures, use technology? But what are the many different ways that you can communicate a single thing so that you can layer in that information to make it easier for people to communicate? So I'll stop sharing my slides there. And maybe I see that we've got a little bit of time for questions. And so I just want to open that up, and also to invite your observations, right? Your own observations of where your challenges are, your own reflections of what's worked and what hasn't worked, as we kind of learn and are all students with one another.
Thank you, Angela. That was lovely. Thank you. So folks, type in your questions and just click on the Q&A box at the bottom of your screen, and take a few minutes to reflect if you like, but we look forward to the questions that you might pose, because we learn from your questions as well.
So maybe while we wait for questions, Catherine, I'll ask you and Sonia, kind of what is your experience? I think this is a nice space where we begin to cross areas, where we think about the importance of connecting just for the sake of interacting, or just the importance of being present, right? That words don't have to always be accurate, messages don't have to always be clear, but that kind of human space, because I do think that's a shared discipline across our fields. And I wonder if why people are getting their questions up, if that's something you guys want to reflect upon as well from your practice.
Mhm. Yes, I think it depends on obviously every unique individual and couple or parent and child, kind of the history of communication. And then, there's this diagnosis, and there are perplexing changes, and there's so much pressure for the care partner to kind of make sure everything gets done, all of those tasks. And I think Sonia will agree, we often remind people to slow down, just be with, and it can kind of reset that pressure a little bit. Recognize that unless it's an emergency, it's not an emergency. Just slow down.
Yeah, it's so very true. And it often feels like an emergency, doesn't it? So I'm going to pick up on a couple of the questions now. I can see them. So,
Yep.
one question is just about how to get involved with some of our programs. Catherine and Sonia, I'm happy to provide them that information and let them share it with people who are interested. And then we can always chat more about that. But we work in close partnership with our community partners, and happy to share it through them. But thank you for that question, and hopefully that works out. I see a question there about, having a person who has PPA, where on the medical chart, should that information, aphasia, be put in the allergy section? It seems like the number of times I mentioned, they just assume he's okay, and they start to rattle off the questions. Yes, and yes, and yes. But I will also share with Catherine, who maybe can share with you. We actually have some built that are cards that say, I have aphasia, and here's how best to communicate with me, or how to help me, and actually explains what aphasia is. And so Catherine will remind me, I will give her some of those cards that she can share out with all of you. And my recommendation is, and oftentimes what I say to families is, put that on the medical chart when you go in, hand it to a nurse. So the allergy section, I wish it would go there. I don't think we're going to get that changed in the healthcare system, but having these types of, I have aphasia cards, here's what it means, and here's how to help me, can be really powerful in that context. And so I'll make sure that you guys get a handful of those that you can use, if that's the case. How do you communicate when the person is sundowning and wanting to go home? Yeah, so this is happening late in the day, when you're tired. And let me just look through the other questions quickly and make sure there's not something similar to join together. I think the beginning could be, yep. How to have the person to understand the falsehood. Yeah. So I think some of these are in a similar vein, and so I'll try to kind of approach them from that perspective. Behaviors like sundowning, and again, I liken that to also trying to communicate when people are tired, trying to communicate when people are unwell and sick and not feeling well or have a headache or in pain. All of these things are cyclical aspects that can make it really challenging to communicate with someone who has for someone who has dementia. And in that repetitive space of just, repetitive question asking, I want to go home. I want to go home. Where can I go? Do I still live here? Do I still live here? Like, those repetitive questions are the things that we know from research are one of the most trying behaviors for care partners to deal with and to manage. And that's not just care partners at home, that's care partners in long-term care, that's care partners working in adult day programs. It's a really challenging behavior. There are ways of, and we may or may not have time to do those fully tonight, but I'm happy to chat with you separately and Catherine can give you my contact information. There are ways of distracting in those moments. So it's not about trying to reason or communicate through the desire to go home, but there are ways and there are strategies that are effective for reducing that repetitive question asking behavior, whether it's occurring in the context of sundowning or not. And I'm happy to share with you some of those approaches. They take a little bit of time to get into place, but once they're in place, they actually work really well. And I'll give you an example. My colleague, Michelle Bourgeois, who actually developed some of these techniques about 20 years ago, took repetitive question asking in one person down from 800 times a day to about 10 times a day. And so they can be really effective strategies, and I'm happy to walk through that with you, because it is definitely a frustrating space. What if you haven't recently included, and is it beneficial to go back and do that? I think if there's been activities that, and certainly happy for Sonia and Catherine to jump in here. And the question is really around if the person's not been involved in activities for a while and you want to re-include them in those activities, is it okay to re-include them in the activities such as financial management, or would that just seem confusing to them because they've already not been doing it for a bit? And I think that's, I'm going to give that ambiguous, it depends kind of answer. I think if you sit down and make that activity available and someone shows a natural curiosity or wants to come down and sit and engage in the activity, then I would just follow their lead. If they don't seem to be engaging and it seems to be an activity that's no longer relevant to them or important to them, then I don't think you have to force to bring them back to, for example, a financial management activity in the home. But I do think what's important from this maintaining connection space and even having the opportunity for more opportunities to communicate is to find a meaningful activity that you both can share, right? And so that may be something that you have a history of doing together, or it may be something completely new, like walking in the park every day, or doing art together, or doing a cooking activity. People with dementia, sometimes have preserved interest in activities that were interesting to them before their diagnosis, but in other times are actually remarkably adept at creating new interest and wanting to do new things. So I think the take-home message is if there's something that's there that they have an interest in, try to leverage and optimize that as much as possible. And if there's not anything, then explore new activities that maybe you can do together. The important thing is having something that's shared and something that's collaborative and something that you both draw joy from, and that give you an opportunity to have that kind of legitimate connection space. So I'm going to address this one, and then I'm aware of time, so I am going to be careful, but there's a couple here on this kind of idea of hearing loss. And do hearing aids help delay the onset of dementia for a person who's becoming unable to communicate? Fantastic question, and one that we don't know of yet. I will say there has been one large randomized controlled trial, big word for saying what we think of as a gold standard study, that has actually shown that for some people, particularly those with vascular cognitive impairment, hearing aids can be particularly effective for slowing the progression of dementia in people who have that dual diagnosis of hearing loss and cognitive impairment, even when that hearing loss is very mild. Now, in more advanced dementia cases, the trial was not successful. So it showed that the results were not as promising as what they had hoped. But there, like with any clinical trial, we learned a lot from that. One of the things that we learned is, especially in early stages of changes, the use of hearing loss or the use of hearing aids may be effective in reducing that risk. We also learned that there's probably a linkage between vascular etiologies, vascular causes, and some of this hearing loss relationship. And we gained information around the types of people with more severe communication impairments who may still benefit from hearing aids. So I think the truth is we don't know about slowing or reducing dementia in those who have, more severe cases, which it sounds like that, your person may have. But what we do know is that if you have difficulty communicating and you also have hearing loss, the added effect of hearing loss on difficulty communicating is about 40 and 50%. And so what we mean is by that is it worsens the challenges in communicating. And what we also know is that breakdowns in conversation and the ability to repair them is more challenging in people who have hearing loss and cognitive impairment. So the point being is that whether or not the hearing aids would slow progression or not, addressing hearing loss is an important aspect for optimizing communication. And that doesn't have to always be with a hearing aid, particularly when people have more severe losses or more behavioral issues or may tend to pull things out of their ears more. There are lots of devices that we can use that are not hearing aids that can be helpful. So I'll leave that one where it is, but happy to talk about that more because this is a really quickly and rapidly progressing area of research. And so trying to help with a person who understands a falsehood, thinking that they're not in their own home anymore and distressed by this. And again, this is a space, Catherine's going to work on this one. And I think, much like my kind of conversation around the repetitive question asking, there are lots of techniques in this space that can work. They all are a little bit complicated, not complicated to put in place, but complicated from it's a little bit of it depends on the context and when this is happening and how it's happening. So it takes a little bit more of a deeper dive to get to the best answer for that one. And so I see Catherine being willing to kind of jump in on that. And certainly if that involves a communication space, Catherine, I'm happy to kind of consult in and see what might be helpful there. Someone asked, is voice volume dropping part of aphasia? Aphasia is a larger term that simply means difficulty with language. Voice volume dropping is not necessarily a symptom of aphasia. However, a quieter voice can be a symptom in some forms of cognitive impairment and dementia. So people can have multiple, when we're talking about what dementia does to the brain, people can have multiple things going on. They can have an aphasia, so difficulty with reading, writing, producing words, finding words, and understanding words. but they can also, remember I said they can have these motor symptoms, right? And so voice volume sometimes dropping is a symptom of some of the motor symptoms that might be happening alongside an aphasia in the context of dementia. And it can also be the case that sometimes when people are having trouble formulating their words, they kind of tend to get quieter or maybe go to a whispers or almost talking underneath their breath, trying to find the words. So this could be a combination of things, both, them kind of mumbling to themselves as they're trying to figure out what they want to say. Or it could be a secondary kind of motor change on top of the language change, depending on the form of dementia. And so you could certainly kind of talk to the neurologist about that. I don't know what form of dementia your loved one is suspected of having, whether that would be consistent or inconsistent with that form of dementia, but certainly worth mentioning. But no, voice volume dropping isn't necessarily part of aphasia, and we typically think about that as an expanding symptom profile for dementia. And I think we've got one more in there, which is how to help calm the person with dementia when they're having a temper tantrum or a behavior frustration behavior, right, and can't express what the problem is. And so this, and again, this isn't intended, I'm not dismissing that at all. What I will say is I'd love to hear more about that, and maybe Catherine can kind of help us connect in this space. For me, addressing how to manage that, we think about this as a behavior you do before and a response afterwards. And so the first thing I'd want to look at is what context is this happening in, so I could better understand exactly what strategies might work, because there's no one size fits all strategy. So understanding, when are those moments happening? What is the context in which they're happening might help us set you up better so those behaviors are less likely to occur. And then there's the second approach of how do I get out of this situation when it does kind of escalate or not go as well as I want. And that's in that more remaining calm space or restating space or using multimodal channels to try to get their message out space. But I think there might be real opportunities to just limit these behaviors from happening. And so maybe we can talk a little bit more in a different context to understand better when in the circumstances, so that I can best maybe help guide on what strategies might be effective. Okay, and so watching time, I'm going to leave it there. I think, Catherine, unless there's others that I've missed.
No, that's all the questions that we have. Oh, no, there's one more, sorry.
I
Well,
see.
this is very similar to the previous question. Oh,
Yeah,
communicating.
it's a little bit different about the person with dementia. And I
Right.
think, Rose, probably what you're asking there, and so I'm going to go back and say a couple of times you guys have heard me say, let's take that offline and try to understand the problem better. And I do want to reinforce that is really because one of the reasons we do this in an intervention form is, again, I take great issue with people who just hand over a list of strategies and say this works for everybody, because it doesn't, right? It does not. And strategies and the strategies you use to connect, the strategies you use to help with communication are very specific to your family unit, you, the person with dementia, your family system, kind of getting to this last question. And it's really important that the speech therapist you're working with, the social worker that you're working with, understand that dynamic so they can best help get you strategies that are be effective, and also that you can feel confident in using. And so if I'm dismissing some of those, it's not because we don't have answers, it's because it takes an individualized approach, right? And working with your family. So when we get to this kind of other spot on how do I talk to other family members and children when they watch these behaviors happen, and it's also confusing to them. And my preferred way to do this is actually just to have very direct communication with children and help them to understand. There's actually some really lovely books that I can recommend on talking with children about people who have aphasia, talking with children about dementia, helping them to understand that these are brain changes, and the person that they love or the person that they're watching may not always be in control of what their brain is telling them to do, and that this isn't directed toward them, The behavior that they're seeing or the outburst that they're observing is not about anyone else who's really in that space, but it's really about a brain that's having trouble managing everything that's going on around them in that moment and making sense of it. And they're lost, right? They're lost in that moment and they're frustrated. And I think my experience as children understand that pretty well. The other approach that we've used quite well is that communication box approach, and helping children create boxes that they can use with grandparents and in many cases parents. So I think the youngest child I've worked with was a 10-year-old whose mom had developed primary progressive aphasia. And giving them control over something they can do is really helpful for kids in this space. So having them make communication boxes, having them create activities that they can do with the person that they love, helping them to understand how to best support communication. I've had people with dementia and their families in early stages create books for the grandchildren in the family to say, this is how you can help me talk better, or this is how you can help me understand better. I still love you, and sometimes I may get frustrated, but here's what you can do to help. And co-creating that, I have someone we're working with right now who's making one of these with her granddaughter, because she has a form of dementia that has really impacted her communication. But while she can still do it, her granddaughter and her have been sitting down every afternoon for the last month, creating a page a day around how her granddaughter can best help her to communicate. So I think children really respond to that co-creation space. When we make them a part of the story and the solution, I think they're less afraid of the event and the behavior. Books for teens too, please. Yes, I see that. And Catherine will make sure I get all that to her. And maybe I'm always inspired when I see people wanting books and think we need to create a special library, or do a fundraiser to make sure that the London Library actually has access to books for children of different ages. We're no longer living in, this is not on this conversation. I don't have to tell any of you this. We're no longer living in a space, and you heard maybe Catherine and Sonia and I having this conversation beforehand. Families are now living with dementia. We went through a time where it was, primarily the spousal partner, in many cases, the daughter who was providing care, and dementia was something we thought about as only affecting older adults. Now we have multiple generations of family living in the same home. We have younger people with dementia. We're no longer in a space that we can just say this is an older person's disease and, children aren't a part of the story. That's absolutely not true. And I think making sure that we're getting that information out to the community and people who need it is really important. Catherine, do you know that last one? So are there any support groups for teens around dementia that we have close by or that you guys are running?
I just learned of one provided by the Ontario Caregiver Association.
Yeah.
Yeah, so I can email that information to this attendee. I'm happy to do that.
Yeah, I think that's great. And I really appreciate the question, because maybe that's, as we continue to strive to provide services to people and families living with these conditions, there's always opportunities for us to think about. And this idea of how we work with families and their many different changing structures is something I think we're all thinking about these days, including teenagers. So really appreciate that comment and question. Okay, thank you so much for your time tonight. I'm sorry I've taken us a bit over, and sorry, Catherine, I didn't mean to take that over from you, and Sonia as well. But every time I do one of these events, it gives me an opportunity to share, some of the work that we're doing. But most importantly, your questions drive they're so important, because they drive the direction that we're thinking about, and they help us to understand better how to serve families, and what the real questions are and the challenges that you're living with. So I appreciate everyone who put a question out there, and again, for helping me to continue to learn. So I appreciate that.
Thank you so much. Thank you to all of our attendees for their wonderful questions. Please reach out to us tomorrow, or if you have my email address, just email me or Sonia. Those who wanted just a little bit more in-depth kind of work with a couple of their challenges, we're happy to weigh in some of our sort of strategies and that sort of thing. I will say, you know, as I was reading through some of the questions, those moments where the person living with dementia is super frustrated, can't express why, sometimes simply acknowledging, I see that you're upset and I'm so sorry. I wish I could help, or what can I do to help?
Yep.
Yeah, sometimes that's a really helpful first step to just connect with the feeling level of what's going on. So,
It's powerful, right? And that's where that gets us. It takes this transaction that's gone wrong and puts it into an interactional space, which is incredibly de-escalating in many cases. So,
mhm,
yeah, I agree. Thank you, everyone. I appreciate it.
thanks.
Bye.